Y bienvenidos a este segundo video acerca de Mastopexia, la experiencia Max, y vamos a hablar acerca del día de la cirugía. ¿Cómo fue el día en quirófano? Espero que lo disfruten. So, tell us, Maggie, how was that day? Do you have any worry? I know you have 3 beautiful kids, so the moms that are watching this, do they need to be worried? Do they need to feel calm? Well, please tell us about it.
They don't need to worry if they're working with you. So I was really surprised that it would be only one night in the hospital. So I made a plan of my own to make myself feel better and to come into the day of the surgery feeling rested, healthy, happy. I stayed at a hotel the night before. So I was away 2 nights, but only one night at the hospital. At the hotel, I had some really good sushi, I got a good shower, and I got a good night's sleep because I felt like that was as important to my results as anything else. And it also meant that I woke up bright and early the next day feeling refreshed, and I think I just walked to the hospital. Anyway, I had to do a little bit of paperwork. You'll be familiar with that in certain ways, just, registering with the hospital. I think I had to pay the hospital facility fee. And then I went straight up into a pre-op space. The staff there who I had not met were super friendly, super nice. The space felt really modern and clean. And I think maybe I had to get a IV there. And basically once the IV was done, I was entirely with your team. I was with your anesthesiologist who had called me the night before, who had spoken to me about all of the things I needed to know about his supervision of the general anesthesia, the amount of time, the precautions taken, the backups if something happens. So I'd already had that conversation in my hotel room without my children. And once the IV was in, I saw him, I saw your nurses, I went into the operating room and I saw you. The surgery playlist is a classic. It is, I think you might customize it because I had mentioned some artists I liked, and I specifically remember hearing Adele.
We have the same tastes. I love Adele.
Or maybe Oasis. We have like the same but very different tastes. We have the same tastes, even though within the taste it's weird.
We are both big fans of Oasis. And they are coming to Mexico! Sorry for the commercial. I have to pay Ticketmaster, sorry. No, not true.
Sponsored by Ticketmaster and Oasis.
And Oasis, yeah. Liam,
hook us up. I just love that feeling of walking into the surgery room because you felt calm and comfortable, relaxed. I think it's a little weird to say, but maybe it's your happy place.
Mm-hmm. Yeah, I feel comfortable in the OR.
I want a surgeon who feels comfortable there, but I was happy that all of a sudden I got sleepy and I woke up.
Okay, let's summarize these points and talk about these certain details that Maggie mentioned. The first one, please don't eat sushi or anything.
I'm the worst. No, you told me not to eat it before a certain time, after a certain time. I follow the directions.
Just try to avoid not uncooked foods. Okay, because you can get an infection, you can get Moctezuma's curse, and you can get very sick the day of the surgery.
I think I knew this. I got like tempura.
Okay.
Yeah,
well,
I know this.
You can eat fried sushi. Okay. Then the second thing, the IV and that stuff. Victor will do that. Okay, my anesthesiologist will do that. Please don't feel afraid about that. That's a very small pinch, so don't worry about it.
And actually, that is my preoccupation, my worry about anything medical. I can stand an injection, like a vaccine going in or something, but anything of blood coming out, I have low blood pressure and I can faint. I can almost have a seizure. Victor knew this and he did a beautiful job because I I normally do not like that process.
Okay, this is called dysautonomy, and that's very common in women between 20 and 40. We already know that, and we do things in order to avoid this stuff. So you have to be very calm about that. Next thing, and I'm glad you mentioned the music. The music is very important for the patient to relax. We always ask the patients, what's your favorite song, or what kind of music do you like? Because it helps to relax, you know. I have to tell you something. I really don't like Adele, but I do like Oasis. I know. Sorry. Let's start that with, oh, she's going away. No.
This is the moment of betrayal. You have witnessed this.
Okay. I shouldn't have mentioned that.
Well, you can see he's honest.
Final. Tell us about the immediate recovery. Was more or less painful than the abdominoplasty? And tell us about that.
Yeah, so perhaps because I don't have a lot of fears or worries about surgery, I felt confident to be there on my own. I think it's very common for someone to bring a support person, perhaps a spouse, perhaps a sibling, perhaps a girlfriend. For me, I just felt like I was in their hands and I didn't really want to have to parent immediately after surgery. But I'm pretty confident that you guys called my emergency contacts, let them know that I was okay. I think they FaceTimed with me. This I don't remember. And I was in this really nice, modern, clean, and quiet recovery room. So many hospitals in the US are like constant beeping and clamoring and talking. You can't actually rest and recover there. And I'm not saying like spend a week in the hospital here, but that first night, while it was not an enormous amount of pain, the abdominoplasty had been uncomfortable. This all felt managed, and yet what I really needed was sleep and uninterrupted space. So I got that. Again, I'm certain you could have a guest if you want. For me, it was a better vacation to have no one. I have 3 kids. I'm never by myself. So that all went well. The hospital facilities were perfect. I was fed nice food. I was checked. Anytime I was uncomfortable, someone would help me with a pillow or adjust my body, or really, I don't remember much of it because it was so smooth. There wasn't really much to remember.
Important things about it. This second phase, I forgot to mention this, and this is very important. In the case that you need an abdominoplasty and also an augmentation mastopexy, I try to divide the procedure in 2 due to the time. Okay, the abdominoplasty will take between 4 up to 6 hours if we also make a liposuction, and the mastopexy, the augmentation mastopexy, will take about 4 to 5 hours. That's the time that I take to the details. I don't know.
And we don't want him rushing. This is not something, there's this concept of the mommy makeover. And I remember reading about that being like, oh, what a great idea. Terrible idea. There are safety limits that have to do with the number of hours you're under anesthesia. Mm-hmm. If it needs to be extended, every extra augment of time is going to be increasing the risk level. The recovery, I cannot imagine recovering for both of these at the same time. And now that I've kind of gotten to know the perspective of a surgeon, having worked with you a couple times, the amount of mental concentration and math and like physical manipulation in an anatomy that you were encountering for the first time. You've seen me from the outside, you haven't seen me from the inside. Mm-hmm. It's an extraordinary amount of work. And I don't know who would recommend with any kind of ethics to be a single surgeon doing multiple things at the same time. It cannot possibly be safe. It cannot possibly be done well. And you cannot possibly have the focus of your surgeon that whole time.
I'm really glad you mentioned that, because That's very important. And let me tell you something about the US. The US surgeons know this. And they think a lot like the way I think. So, because the most important thing is the safety. Safety to the patient. There are a lot of hours in the OR. That cannot be safe. As Maggie mentioned, once you increase the time up to more than 6 hours, you get this logarithmic increase of risk. And you can get very serious complications. If not in the surgery, after the surgery. As she mentioned, I cannot focus for more than 5-6 hours. I'm human. So it is very difficult to focus on something. Then the risks of scarring, your body needs to heal. Okay, so it's not the same if you have just one scar, of the sum of all the scars are like this. It's not the same for your body. So it is very risky to take these surgeries at the same time. There are certain cases when they have a very little patient that has almost no amount of fat, then you can make a little abdominoplasty, and the breast augmentation is very simple. You don't need mastopexia, and you can combine. But in my case, performing a mastopexia, augmentation, abdominoplasty, liposuction, it's not a good idea. So it's good that we remember that we mentioned that. So
this is why I so trust Illich. I'm talking about you like you're not here. But I think if you were to encounter a surgeon who just says yes, 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 and lets you sign up, this is a super red flag. One of the things that helped me trust you so much was you would assess me and have an idea of what would be safe, what would work over a period of many years, but also what would work within my whole body system during the recovery process. My body was able to focus on one thing and then another thing rather than both at the same time. And your ability to suggest that and explain that and show how it was in my best interest, and frankly, your best interest, to get the results to the standard that you are delivering. I really trust, therefore, when you say, yes, let's do this. Yes, this will come out well, because you are saying that based on your expert eye, your evidence, your confidence in yourself, and your knowledge of the latest medical practices. So when you say, yeah, I think we can add an implant here, I think it should be this size, or I think we should hold off on doing anything with your breasts until you finished your abdominoplasty. That to me was green flag gold. What is green flag gold?
I don't know.
There's no such thing.
It's
like luck of the Irish. I don't know.
Exactly. That's good.
That to me was a big green flag that made me feel confident that I could partner with someone who I trusted, who had my best interests at heart. And if, like me, you happen to live nearby, that seems like an easier yes, because I don't need to think about hotels and I don't need to think about time away from work. However, I think there's a lot of pressure and hope that people have that if they can come to Mexico, it is going to be, yes, state of the art, yes, excellent surgeons, yes, excellent facilities, but we can do it all really fast. And I would caution people against that fast thinking. You wouldn't do that at home. So, okay, you are getting all of these benefits of the facilities and the surgeons and the latest practices, and at a very reasonable, very fair cost. So give yourself that extra safety that you are able to afford 2 trips. You're able to afford a few weeks in a nice hotel. The hotels here are really nice. So it's really not a burden, and it is only to your benefit.
That's very important. And this is for you, the US citizen that is watching this. If you don't do that at home, why do you want to do it here? That's very important, and I wanted to say goodbye with this important thing. So, espero que les haya gustado. Es muy interesante todas las cosas que se mencionaron aquí por una paciente que no es mexicana, por una paciente que viene a operarse. Es muy importante. Recuérdenlo. A veces los movie makeovers hay que hacerlos en etapas. A veces por querer hacer todo en una, no tienes una buena recuperación, no tienes una buena cicatrización y te expones a muchos riesgos que ya vimos que son logarítmicos. Todo esto está basado en evidencia, ¿vale? Está basado en evidencia. Si no puedes hacer una cirugía en más de 6 horas, empezar a correr el tiempo a más horas eleva los riesgos. Y eso es muy importante para todos los que están escuchando, todos los que estén planeando un turismo médico. Ahorita que está súper de moda Turquía, ahorita que está súper de moda Tijuana, ahorita que está súper de moda todos esos lugares en donde te ofrecen muchas cosas al mismo tiempo. Por favor, sean precavidos, piensen en su seguridad, ¿sale? Nadie te habla acerca de las complicaciones. Y las complicaciones en un país extranjero, en donde tus seguros pueden no cubrirlos, que van a ser un gasto mucho mayor, eso es muy, muy importante. Me encantó que llegáramos a esa conclusión. Espero que les haya quedado súper claro. Y nuestro siguiente video, ya pasando a otros temas, va a ser acerca de la recuperación. Espero que lo disfruten. Gracias, Max.
Nos vemos.